Hello everyone. This is Dr. Sam Dubé on behalf of Agora Media and the Toronto Business Journal. I'm here today with the president of the League of Rights and Freedoms, that being Alexandra Pierre from Quebec. And we are going to be talking today about the curfew that was instituted recently by the provincial government of Quebec that is in effect until at least the 8th of February, this being approximately mid-January of 2021 during the COVID-19 pandemic. Alexandra is president of an organization that actually has been advocating for human rights for 50 years. So Alexandra, thank you so much for joining us today. I know you're very busy. I know you've got another interview right after this. So our heart goes out to you. Thanks so much for being here.
Thanks for having me. Thank you.
So I mentioned a little bit about the curfew already. Would you like me to just mention it? It's a curfew. Literally, people have to stay home from 8 p.m. until 5 a.m. in the morning, with very few excuses, unless you're an essential worker, unless you're doing something that's essential to survival. You can't be found outside because there's actually a fine of between $1,000 and $6,000 if you're caught.
Exactly.
So can you tell us what some of your concerns are with this curfew? Can you please tell us?
Yeah, we have a few. We're kind of puzzled by this curfew. We have a few concerns. For us, Legault and its government, so Minister Legault and his government, is putting a lot of pressure and putting a lot of responsibilities on the shoulders of Quebecers. Of course, the situation is very serious. We're aware of that. And we know that everybody has to do his part. But we feel that if Quebecers should have to do their part, the government should do their part too. And for us, one of the major problems is that there's a lot of things to do even before thinking about this curfew. For example, we know it has been a few months now that we know that aerosols are a very important cause of transmission. So we should be right now thinking about how to improve indoor ventilation. We know that for sure our testing and tracking capacity is not optimal. So where are we on that? Aren't we working on that issue a bit more intensively? We know also, for example, that healthcare workers have been changing from facilities to one facility to another one, from one day to another day, and it's a VIN month, and we know that this is part of where the transmission is taking place.
Yeah.
So why is it still working like that? So we have a few questions and a few questions about that, and we're wondering, why is it that instead of working on all those issues, we are being imposed in curfew, saying this is basically your fault because you're going out from between 8 p.m. and 5 a.m. You're going out, so this is your fault. So this is kind of our concerns. It's like the government was saying that we need a shock treatment.
Yes.
So okay for the shock treatment, but it must be linked to the problem, and the target must be right. And we feel that this target is not the right one.
Yes, and in fact, I read several articles in which you're quoted, and very, very eloquent, by the way. You presented wonderful arguments. And there was a Quebec politician, you'll have to forgive me for forgetting who he was, but he said, oh, the curfew is not really going to affect people who are already respecting the common sense type of health decrees here. These people are largely staying at home anyway. But he was forgetting one big group, wasn't he? And you and I talked about the homeless.
Yeah. Exactly. The thing is, when you're putting out some measure like this, very exceptional, very heavy, you have to think about the effects also. And one of the effects is obviously that people living on the streets, people experiencing homelessness, don't have anywhere to go. So what do we do with that? And obviously, the government didn't think that much about that. The fact that people who are experiencing homelessness have nowhere to go. The fact that the shelters have been for years overcrowded. They don't have enough places. The fact that from the last weeks, there's been a closure. Can we say that in English? Yeah.
An outbreak.
Outbreak. Sorry.
Yes, no problem.
Outbreaks in some shelters.
Yeah.
All that means that you're basically saying to people experiencing homelessness, just do whatever you can, go wherever. Yeah. Well, there's no places. And for us, it's again a question of collective governmental responsibilities. This is also their responsibilities. And as I was saying in a few interviews, like two things. First of all, the fact that the social and racial profiling didn't disappear overnight.
No.
When we just celebrated the new year. It's still there. We have to work with that fact.
Yes.
And the fact that Minister Guilbeault was saying that she's counting on the judgment and the discernment of the policemen.
Yes.
Seems to be quite talking about police discretion,
yes.
or arbitrariness. So for us, it's a problem. And it's also a symptom of the fact that the fact that we have a our tracking and testing capacity is not optimal. The fact that the working condition of the health workers are what it is right now. The fact that we are not able to put some indoor ventilation which is adequate in our schools. Everything's it's symptoms of what we've been doing with our public system also. Right. And for us, it's very important to underline that human rights, either civil rights and liberties, but also social and economical rights, should be our guide in this crisis. It's not a thing that it's too complicated. We don't have time to think about it. There's some other emergency. No, it should be our guide. And if we're in this situation, it's because it has been many years since it's not our guide. And we are cutting on schools budget. We are cutting on healthcare system budget. Our public health services have been under a lot of pressure. Not a lot of means for years. So that's why we're here. Can we just take a moment and think about the rest of this crisis and the other coming, because there are probably others coming of other nature because of the system we're living on. So can we just take a moment and think about how human rights, social, economic, civil human rights could be our guide to make a better decision? So
you put it so well in an article. You mentioned how this has become a crisis in public health. It's been transformed into a crisis in public security. And as a result, there ends up being a restriction on individual rights and freedoms. and not only that, but an inequitable one with certain groups being effectively and indirectly even targeted, and potentially unwillingly, but it's happening nevertheless. So what can we do, Alexandra? What can we do? What can people in Quebec do? How can we fix this? What can happen at the grassroots level? Is there anything that can be done?
Well, there's a lot of organization like us, but others. We were talking about the people experiencing homelessness, for example, yes, who are on the field working. And basically, I think what the people can do is being critical, follow our website and or Facebook. But
what's the link? Can you tell us the link for your website?
Ligue des droits. .ca.
Okay, so that's in French. So that's you want to? I can spell that please. For us. LIGUE DESDROITS period CA. Ligue des droits.
Yeah, exactly. So that, of course, but also keep for us. The main message is to keep in mind that human rights. Social, economic, civil, human rights should be our guide in this crisis. And when we talk about being our guide is to make sure that our public system in many areas, which is school, healthcare, elderlies, family policy, like concerning family, all that should be the human rights should be our guide, because at the end, to go through this crisis, we have, of course, our judgment, and we have to do our part, but basically we cannot go through this crisis without our public services, right, or collective services. We cannot do it as individual. We'll go through that, and we'll be safe when we think as a collective, as a society, and we offer collective social solution to this kind of problems.
So, Alexandra, I'm going to ask you a question that we actually did this interview also in French, and they're slightly different. So if you're bilingual, you should listen to them both, by the way. I want to ask you this question. You expressed a concern that there may be other crises, public health crises, for instance. Maybe it's already been announced that there's a more virulent strain of COVID that has appeared, and it's actually infiltrated Canada. You mentioned, and many people feel this way. There's a lot of researchers and primary health practitioners that feel this way, that this is one of many. And the infrastructure being laid now with these curfews and these restrictions and things is what's going to be our pattern in the future. Do you feel that part of the reason we're implementing the curfew now in Quebec, or it's being implemented rather, is because a pattern is being established? Do you think that perhaps this is preparation for more, that they're trying to perhaps establish a protocol that people will be more willing to follow? You know, I'm kind of shooting in the dark here a little bit, but there is that concern, and it's coming from different, right?
Yeah, I would say that I don't think there's a grand,
agenda. You don't think
grand agenda. I think the pattern have been there for years.
Okay.
It have been there for years. The idea of we don't need public services. We don't need this kind of healthcare system. Austerity was all about that. We don't need that. People will take care of themselves by themselves. And so this pattern for La Ligue have been going on for quite some years now. So there's no grand shame about that. We think that it's the curfew and the idea of taking care of social crisis as public or as security crisis. We know all that. The pattern has been there for quite few years now. So what we're saying is that it's just another step towards that. And what we're saying basically is that we can break this cycle. We can break that.
Yes.
And we just have to take a step back and think about what kind of effective, resilient system we want. On what basis? For us, it's quite clear that human rights should be the basis of a resilient, effective system to make sure that, and I hope it won't happen, but to make sure that for this crisis and eventually for the other crisis, we are resilient, prepare, and have collective solution to that.
Yeah, you talk about focus. I'm not going to let you go yet. I know you got to go, but I'm pretty sure in Europe there was an effort to bring the attention to a type of focused protection, and I think it was called the Barrington Declaration. Forgive me if I got the name wrong, but it was basically about protecting the vulnerable segments of society. So they would include the elderly and the infirm, the socially disadvantaged, such as homeless and such. And this has not been implemented at all, and yet there are some real experts who are advocating for this, and we haven't heard about this at all here. So I don't know if I even have a question for you, but is there anything else you would like to talk about here today that perhaps you've not mentioned in any other interview? Something of import, something that you've been mulling over in your mind, that you've been thinking about, that you would like to get out there as a message, because you have the platform right here, right now.
Well, not something new. It's just basically our message is to say we have to think about this crisis in terms of human rights.
Yes.
And consequently, we have to think about collective solution. And the major problem of this curfew is that it puts a lot of pressure and a lot of focus on individual attitude, and this shouldn't be the focus.
Right.
The collective.
I understand
solution.
What you're saying. Yeah, and you mentioned that in several newspaper articles that comes up. Now, in the French interview, we talked briefly about statistics, and you mentioned, we're getting conflicting information. We don't want to touch the stats because we don't know necessarily how valid they are. But there's the question of, is this helping? Is the curfew helping? And there are medical authorities who feel that it is, and there's medical authorities who feel that it isn't. So we're getting conflicting messages, right? What do you have to say to that?
Well, I'm not an expert, and in public health. What I saw is that at the press conference, when Dr. Arruda was asked if the curfew will change anything, he basically said, we're making this announcement because we need a shock treatment.
Yeah.
We're not sure that there's a link between from other countries' experiences.
Right.
We're not sure that there's a link between the curfew and some result, which means the reduction of the transmission. So we're and we know that there's it's not that clear.
Right.
Well, it's another reason to put some focus and some effort on those collective solutions as indoor ventilation,
right.
Testing and tracking capacity, make sure that the condition of work of health workers are better. And I have to say that the government, it's not inevitable. Like, for example, the government made a step when a few months before he said, okay, we need some other orderlies, and we are going to train them, to pay them correctly, to make sure that a lot of people come and bring an end to help this crisis. So he did something. This is collective. That's what we need.
Right. And so there are examples of this. So you feel it can be done. It can.
Okay. It can. It's not simple, but it can.
Well, I know, Alexandra, you have to go, and I'm so grateful that you spent this time with us. I know how busy you are, especially during this time, but I just wanted to thank you on behalf of Agora Media and the Toronto Business Journal. I'm Dr. Sam Dubé. For all our viewers, thanks so much for coming out and participating in this interview.
Thank you.
And I know your organization has been advocating for human rights for 50 years. And so check out their website. In English, it's the League of Rights and Freedoms. In French, it's a Ligue des Droits. And the website is in that in French. So LIGUE DES des droits DROITS period CA. So if you can look that up to get more information. And you guys are quoted everywhere in the Quebec media as proclaiming a concern about what's going on. And I hope that the curfew is not needed, and that we look more seriously into it and its need, and if anything were to be implemented, that these social concerns are taken more seriously. So thank you again, Alexandra.
Thank you for having me.
You're very welcome. You're very welcome.
Thanks.
Take care and Godspeed to you.
Thanks. Bye. Yeah.